Hi, I'm Dr. Rajani, and today I'm talking about facial fat loss, how to avoid it, how to fix facial fat loss, and filler migration and dissolving. Why are we seeing facial fat loss from that? Many of you are just seeing fat loss from aging. This video will apply to you as well. And some people, unfortunately, through home devices with RF or in clinic devices, are seeing fat loss where you don't want it. So it's aging you. All of that will be covered today, and we'll have solutions for you. But understand, it's one of the reasons why I developed the initial protocols working with PRF, and then the protocols, of course, for Easy PRF and Easy Gel, because using your own products, your own exosomes, growth factor stem cells, is one of the ways we're going to talk about today to help support your facial fat pads and help get your volume back. So 92% of my patients do not know this. And this is facial fat loss. And remember, restoring facial fat loss will do what? It lifts the face. Okay? It makes it more youthful, like over here. Now, I want to show you. Imagine if you lose under eye fat. Well, that's what you get. Yes, there's some herniation of the fat pads, but it's the loss of fat pads and the shifting down of the fat pads that creates a lot of the issue. Now, what about down in the face? If you lose the fat in the chin area, in the mental area, you get a mental crease, but you also get a jowl. So restoring the fat along the jawline and a little in the preauricular area here, that does what? It lifts the face. Now, if you look at the nasolabial fold, which bothers so many of you, yes, there's a little bit of fat loss here, but it's mid-face in the deep medial fat pad that causes the drooping and the subsequent fold. That's why filling the folds sometimes looks unnatural. So we underestimate the ability of restoring facial fat to lift the face. And remember, fat has what? Yes, stem cells. I can talk quicker than I write. And growth factors and exosomes, all the good things we want. And that's why restoring it gets you to that. Understanding dissolving fillers has become a thing. People are getting a lot of fillers. They think that a little bit of filler looks good. Often that's true. But when you get more filler and you get too much, because a little looks good, so a lot must look better, right? Well, it migrates. What does that mean? Well, filler, hyaluronic acid can be dissolved. Now, keep in mind, other fillers can't. There are permanent fillers that are FDA approved, like Belafil, and biostimulators like Sculptor and Radiesse. They cannot be dissolved, despite what you might hear. So we're talking about hyaluronic acid filler dissolving, but that's the culprit, the main culprit for migration. And the number one areas is going to be around the lips. And of course, lip filler is the number 2 most popular area hyaluronic acid fillers are injected, but most importantly around the mouth as well. Why that area? It's a movement area. Why do people have a stiff looking face? Well, it's not just from the fillers, but to avoid migration, take filling the glabella. And I know the frown lines, you'll say, oh, you get blindness, you get occlusion. In Asia right now, it's common to fill those areas, but you also Botox them. So slowing the muscle movement down around the mouth or in the glabella, wherever you put the filler, will help prevent migration, but then it looks a bit unusual when you can't move, right? What happens when people get dissolving? Well, here's the problem and why they're losing facial fat with dissolving. You can dissolve the whole thing with high doses, but that's not the problem. It comes to the fact of the dissolver used. And there's ovine, so from sheep, and bovine, which is related to cattle. Those are 2 examples. And then there's recombinant DNA technology that can be used for dissolving. But dissolving clinics that are springing up everywhere tend to use the cheapest product because their hope is they dissolve it and then they'll charge you to refill it back. So the dissolver used definitely makes a difference. Now, if we shift over and we go, well, you've lost facial fat from aging, we'll address that in a minute. But you clearly see here just the naturally aged face without adding heat or these filler problems is an issue with facial fat loss, and that's why this video will be applicable to you as well, even if you haven't had dissolver or RF or heating devices that have left you without facial fat. Now, before we go on, please click the like button and subscribe to this channel. I found out only 35% of you that watch and get value from these videos subscribe, but doing so helps me bring you more videos to help in your journey of beauty, skin rejuvenation, and glow. But if we then go to RF and heating devices, yes, heating in the range of 43 degrees Celsius for 15 to 20 minutes plus will often lead to facial fat loss in a select group. When we're targeting fat, we go to about 67 degrees Celsius plus, but externally applied heat at about 42 to 43 degrees, which is what you can get with some of your home devices. Keeping in mind, it's not just the absolute temperature, but also the depth that the device goes to. How are you to know? Well, don't worry. Next week, I'll have a complete video on an at-home device that I've fully tested to be safe and very, very effective for you. And of course, in clinic devices, leads to the death of fat cells. That's good in some areas like the edge of the mouth or the top of the nasolabial fold, but it's bad for the rest of your face, particularly the under eye, the forehead, and the hollow cheeks. And that's where people need to replace it. Losing fat cells in this manner from exposure to heat is a process called apoptosis. Now, apoptosis is a natural method by way of the body eliminating old cells, and then it rebuilds new ones. However, exposing fat cells to heat turns on apoptosis, and that's how the cell dies. And the problem is you don't know how much heat you or I or someone else needs to turn on that programmed death of the fat cell. You might remember a term called cryolipolysis. That's when you kill fat cells when they're exposed to cold. Well, there's a mechanism also with heating. So what do you do? Well, the key here is move to the most natural method you can and the most natural biostimulator. Certainly, many of you, I know you don't want injections. That's okay. You want to watch this video on a lipofilling type of cream. But what about clinics? What are clinics around the country and now the world offering? And the most successful clinics around the world doing this now are adding platelet-rich fiber in a blood draw. You spin it down. It's all you. There's no additives, no blood thinners. And it's your own growth factors, your own exosomes, and your own mesenchymal stem cells that help your fat pads rejuvenate. And that's what you want to be thinking no matter what your fat loss is from, but particularly if you had it from dissolver, from filler migration. Now, if you're a provider doing PRF and making Easy Gel or Easy PRF, I updated my protocols. I'm going to give you a tip later on in this video that's in those new protocols that I'm using now. And my free course to learn all of this is at aesthetictrainingcenter.com. The next question becomes, well, how long do I have to wait before adding volume back after dissolving? Because remember, a lot of the product in your face, you probably liked it. You liked the look of the volume that was there, even though the filler migrated, it moved, made you look unusual or stiff. An element of that added youth. And maybe that filler was in there for 10 years because filler lasts in the face. Now we know, of course, for 7, 8, 9, 10 years. Doesn't just go away with your own natural hyaluronidases in your body, but rather it migrates around. And some of you have less hyaluronidases to break it down than others. So some people are prone to that. And then that volume, when you lose it from dissolving, it's shocking how aged one might look, because some of that volume did good stuff. So you want something added back as quick as possible. Now, you can add PRF back the same day. I much rather prefer and wait 3 to 7 days after dissolving before putting the PRF back in there. These type of PRF injections for pan facial rejuvenation are best done with a microcannula. For those of you wanting the mesotherapy effect and intradermal, you're better off using a nappage technique with a little needle called PLASMABoosters.com. When we look at the graph of PRF It's going straight up, as you see from the Google Trends here. Why is that? Part of it, of course, is people not wanting fillers, people not wanting anything synthetic, but a huge part of that is because dissolving clinics are on the rise and people are dissolving the fillers that are in their face so that they look more natural, and of course to get rid of that migrational look, oddity, and the effect of movement of filler has in the face. Because when it gets to be in the wrong area, it can not only look aged, but you can be very self-conscious because the face looks distorted. And yes, these are panic calls that you get from people because they might be having dinner with someone, or a good friend sits them down, has a talking to, and says, "You look unusual." That's what's happening. Now, I promised you that tip if you're doing this procedure, and this is going to give you some insight, even if you're not a provider, as to why it matters about the protocols that you're using. And when I developed these, why it's so important to use the right spinner with the right tube. Here is the PRF. You see it on the rack, but as you withdraw the PRF, if you leave these on the rack and you go do your procedure and you come back, even though you've taken the initial aliquot of PRF off of the top, what will happen is the light things percolate to the top. Well, what is light? Exosomes, growth factors, and platelets. Those growth factors, exosomes, and mesenchymal stem cells hang around with the platelets. They're all light, so they move to the top of the aliquot. So wait 20 minutes, because now you have cool tubes if you're using my protocols, and you're going to, so it won't clot, and you're going to have all the goodness move up to the top. So before the patient goes, or somewhere within that procedure, pull off all that extra stuff from the tubes. That has a lot of exactly what we want for the regenerative properties. Remember, this isn't a fast spin. It really matters what you pull off, how you make your aliquot, and what you place into the patient. You want the most growth factors, exosomes, mesenchymal stem cells. If you have none of those, you might as well inject water. And that's where some of our patients, they're not seeing results. But the majority of people get great results because people are using my protocols on aesthetictrainingcenter.com. So you see, not all PRF is created equal. Now, to make better sense of this, you're going to want to watch this video on how to prevent facial fat loss, one down here on how facial fat influences your face and attractiveness, and one up here on how LED light can help your facial fat pads to keep your skin and body beautiful, healthy, and vibrant.